My name is Sandy. I am teaching at the Ewha Women's University in Seoul, South Korea. I believe I was invited because of my experience of working at 2 Olympic and Paralympic Games at 2018 Pyeongchang Winter Olympic and Paralympics and also 2020 Tokyo Olympic Games. So I prepare my talk with the title of Path into Being a Sports Pharmacy Specialist. So the purpose of my talk is I was just things together with you about what is a sports pharmacist and how to be a sports pharmacist and what is the role during the game and also out of the game. Because most of the time we don't have games, even though we wanted to work for the games. And what are the action plans needed for our basically customers. So I'd like to talk those topics with these contents. So I believe most of you are interested in how I involved in the Pyeongchang Olympic Games. My first opportunity at Pyeongchang 2018 was I was appointed as a head pharmacist of the pharmacy department at the games. I believe there is one more candidate as the head pharmacist at the time, but I think they were looking for communication skill, because as a Korean, we don't use we don't speak English in my country. I think that was one of the components they are looking for a person, and also practicing experience and leadership position, and also multicultural education background was a bonus for me to be selected, because I studied in America, the pharmacy school, and also working at the University Hospital in Philadelphia area. So I think that was the one of the reasons that I was candidate as a head pharmacist. And then I went through several interviews with IOC medical committees and also the IOC pharmacists, as you all know, that the Mark Stewart at the time. Of course, another candidate was very hesitant to be involved in sports pharmacists because it require time and effort, and many things has to be sacrificed. But I don't know why, but I wanted to be involved in. It was 2-month period commitment, but I didn't mind at all at the time. I just was very curious about what's the sports pharmacist that would work in that situation. So I was started working over there. And after I being as the head pharmacist, and I started to recruiting the other pharmacists to work with me together. So the recruiting process for the regular pharmacist was there was advertisement through the official Olympic and Paralympic website as a professional volunteering opportunities. Then I was waiting for the people to apply, and the recruitment criteria for those candidates was I prefer at least 7 days of working in that polyclinic in a row, and also preferred English speaking proficiency, and also pharmacy actual experience as a clinician. And also work, because we had 2 different pharmacists, as one for 6-year program in the PharmD pharmacist, and also 4-year in the BS pharmacist. But at the time, most of them were PharmD pharmacists, because they were, I guess, young and not really have a family. They more freedom to spend the time in that long period of the volunteering. And once we formed the pharmacy, they have this kind of activities together. As you see from the left upper corner, the pharmacist doing the prescription validation as a usual work that we do all the times, the preparation and dispensing medications, and also counseling, patients and athletes. And also once you move to the right side, right upper corner, we do have clinical activities, including clinical interventions. Basically, we look at the prescription drugs one by one, make sure that they are not against the doping issues, and we provide drug information. We actually tell athletes and trainers about introducing the global drug website, how to look at the medications one by one if they wanted to look at certain medications. And also we actually started documenting and review. We actually documenting daily dispensing record every day, and we review every night for what medication has been dispensed, how much, where to go, and what athlete is using certain medications. That intervention, documentation review, was very useful during the time. I'll just explain how we use that, more other activities together. And also, once you move down to the left lower corner, there are lots of policy and procedures specific to the games. The sports pharmacists should understand and apply those policy and procedures. They are anti-doping policies by WADA prohibited list of medications and methods, and also how to process the therapeutic use and exemption, and IOC needle policy, injection declaration, and also medication importation declaration. The last two, the IOC needle policy and also medication importation declaration, is not really directly involved, directly linked to the pharmacist activities, but still good to know to see the whole picture of how medication is moving in the village or in the Olympic site. And also the right lower side, we developed the pharmacy guide and also preventive pharmacovigilance activity we were doing, and we managing the polyclinic pharmacy and venues and emergency room, and also handling the controlled substance, always tricky issues, especially this kind of a temporary, setting. But that was one of the things that we have to do. I just mentioned about documentation review. Once we do the daily report form and review the daily dispensing record every day, we actually be able to track down what certain medications dispensed more and less to certain athlete or certain village. For example, because it was a winter time, if I see the ostelmavir prescriptions increase suddenly to certain village, we were able to check what something is going on. We communicate the medical team and let them know they check with the village or the teams. And also we can talk to the NOC doctors to see if there's any issues with flu, or if I see the loperamide, then we know what is the sign of using the medications. So those things that we can track down. So it was very interesting activities at the time, and we are very proud ourselves to be able to do this. This is a little pictures that I brought from the Pyeongchang. So we have two polyclinics at the time. One is a mountain side because we have alpine skis and all the snowboarding side. The another polyclinic is located in the city side, has ice rinks or lots of indoor winter sports is going on. So it was a kind of big tent shape of a polyclinic. We had political issues at that year. There were I heard that lots of budgeting is cutting down. So they had a tent style temporary polyclinic. It has a one floor with a big basement. When you get inside the polyclinic, there's lots of people, but you will see background that there are small doors by doors. This is all the each internal department or ophthalmologist or physio or lots of different medicine services provided. And also at the time, we had a Japanese medical committee visited Pyeongchang. So we took the picture together in front of 5 rings. And the right side is a Paralympic symbols. We took the picture with our pharmacist at the time. So I have one more slide with the pictures. This is inside of pharmacy at the time. It's a small pharmacy. In the center, we have a dispensing table, and on the shelves we have certain medications we were using for the athletes and lots of many the personals. And this is our pharmacist. So we have 2 pharmacists doing one shift, so that we can double check every single medications. And the third pharmacist coming into the afternoon shift, evening shift, and there are 1 hour overlapping, so they can do shift sign on and sign off. She is the director of pharmacy, is a local hospital, So the Department of Pharmacy was big support to labor and medication supply to the polyclinic at the time. This is a similar picture with the head of a surgeon and also head of rehab. So in front of the dispensing table, they are doing prescription review and entering the orders. The lower side of the middle picture is in another side of the second polyclinic. This is a pharmacy inside. They're doing the preparing the medications. And the last one was a patient counseling, the picture that you can see. So we were without any accident. We were able to wrap up the Pyeongchang in the pharmacy service at the time. But it was very nerve-wracking for me because I had not really that much knowledge about the sports pharmacy at the time. I studied more in the sports pharmacy. So I did the IOC drug and sports certificate. At the time, I met Ashley and Summer at the time. And also after the Pyeongchang, I thought that it is very interesting area that we have to share that opportunity and scope of our practice to other pharmacists. So I did some publications to advocate our sports pharmacy area. And the second opportunity came to me without any expectations. At the time, because of COVID-19 was hit this Tokyo 2020 games. So actually their game was 1 year postponed. So it was held in 2021. So before their Olympic start, I was helping to educating the Japanese pharmacists at the time, the online education, just like this, like online symposium. Then I attended and I just talked to them about what was my experience like, what was the daily life or daily routines, what's the challenges, what's the difficulties, how I resolve the issues, what's the things that pharmacists is hard to expect, those things. And then I think 1 month before the Tokyo opening day, they actually asked me if I can come over. I think severe that they wanted to have extra help, the person who has a previous experience. So me and also another pharmacist from the island, I believe. So she and I came to the Tokyo and helped them out during the game. So I covered first 3 weeks, and then she covered later part of the Olympic period. So this is the beautiful picture of the Tokyo Olympic. So this is in front of the 5 rings, and just enjoy the pictures. In front of 5 rings, there's a big grass area that people just lying down or sitting and talking and eating some snacks. And there is a water fountains. And the right side is the reception, the entrance area with the gift shops. And the second slide, this is the Tokyo 2020 pharmacy. This is the left to upper side. This is the pharmacy from the outside. The blue is the counseling desk where drop off and pick up the medications. And there's a small door. Inside the door, there is a pharmacy dispensing area. When you come into the door inside, you will see the inside, which is upper right side of the picture. This only me enjoying this, the Tokyo 2020. The other pharmacists are very nervous to not make any errors during the time. So I took the pictures, lots of pictures. You will see the medication cabinets and shelves, and in the center there's a table which is entering the prescriptions and review the medications. They're just working together. In the down lower side, the middle picture, the pharmacist counseling the athletes and etc. So funny thing is that because I was guessed that I have less burden to involved in the pharmacy activities, I was enjoying pretty much. But when I was in Pyeongchang, I even didn't know where the 5 rings are and what looks like in outside of pharmacy. It was very nerve-wracking moment. To I just want to tell you about it. So after with this my 2 experience, I was rethinking what is the sports pharmacist should be or would be. I think many textbooks says that the role of a sports pharmacist is to protect health of athletes, but it's more than athlete. I believe it is more like sports population. Sports population means that anybody who are involved in sports activity, we can help them in many different ways. In the middle side of this slide, to respect for medical and sports ethics, we need to respect the medical and sports ethics. But also we can educate the people who are involved in sports. They need to respect the sports ethics that actually connected to the careful about medication use, not against doping issues, and using the right medication, right dietary supplementary, and always consult to the pharmacist or other professionals. So I believe this is a lot of, based on this slide that I organized, there are lots of things that we can do for, this sports population. But issue is that where to work. I mean, I had a 2 experience in, biggest sports activity, but not many, sports pharmacists that has that opportunities, I know. We can work as a sport field-based activity, but also community field-based is also very important things that we can do as a sports pharmacist. So which means that international games and also local games, I believe other countries like United States or Turkey or UK, Japan has lots of local sports activities going on compared to the Korea. I don't have that much experience other than these 2 Olympics, but I believe you guys have a lot of different involvement opportunities if you're looking for in locally. And also community field-based activity, I can give you the example about education at school or education at local clinics, with the professionals or with elite student athletes, or even I mean, I can tell you more about later, but lots of different roles that we can do. So I'm more like a focus on community field-based activity. In my case, this is my case. After I do the 2 Olympics, I still keep interest in sports pharmacy. I mean, I'm working in the university at this time. Sports pharmacy is not really a hot issue, not yet. So I have other things to do, but I still keep interest in sports pharmacy, in doing lots of advocacy in my country. I involved in the Korean Anti-Doping Agency, CADA, we call it CADA, and also Korean Soccer Association. How I work, working as a consulting or committee members, and also I was opportunity to support pharmacy services set up at local games, which was we have a national domestic the games in every year. So I help the local pharmacy association to set up the pharmacy so that they can work as a sports pharmacist at the games. And also I provide educations for elite athletes, which this is our Korean soccer elite players. I do the education for them and also for the professionals and also for trainers. I mean, it is much easier nowadays because COVID, I can do the online education anytime, whenever they want. So it's much more approachable. So if I just summarize those community field-based activity, what I'm doing, I can just summarize 4 different fields. Supporting, which means I supported my pharmacy associations, local associations, to working as a sports pharmacy for local games. And the consulting, I work as a CADA, and also I work at the Korean Soccer Association. And also as education is another things that I'm doing for medical professionals, doctors, and also other pharmacists, and also students, and also advocacy. I do sometimes SNS or newspaper or YouTube, etc. But doing this one, I always have certain dilemmas. I think this is a challenge that we all have. The first one is many people ask me, how do I involve in Olympics? That means that they are disappointing due to less chances of participation to sports events. So this is, but I just want to, now I'm not sure if I can have another chance. I don't believe that I would have another chance to be in the Olympics anymore. But I'm just thinking now at this time that I need to develop another opportunity for myself to being as a sports pharmacist. And my second dilemma is that there is always professional satisfaction versus compensation. Working at the Olympic and Paralympic Games, some pharmacists sacrifice their whole year vacation time because they usually ask for 1 week, the commitment. Working as a volunteering means that they need to sacrifice their vacation times, or they have non-paid, working here in the Olympic without, giving up those, the labor. So that is always the issue. And during working in the Olympic, it really depends how much we do get the compensation is really depends on game by game. In Pyeongchang, we had a very small amount of compensations for the pharmacists, which is not comparable to our, the regular rates. So this is always that have to think about it. And also volunteering versus liability and responsibility. Working as a pharmacist in hospital setting or community pharmacy setting, we have insurance, liability insurance. We are protected with a certain extent, but volunteering is not really. So this is another issue that you have to think about. Even though we have lots of dilemmas and challenges, but still this is a very big and very nice opportunity as a pharmacist. We cannot give up this opportunity. So the action plan, my suggested action plan is that we have to think about how much we can expand our scope of practice as a sports pharmacist. When you think about population to need that our service is a very huge population. I mean, the Olympic is more likely to be, amateur or a little bit of professional athletes. But when you think about, students, college athletes, or varsity in high school athletes, or small, elementary school kids who are involved in club setting, they are all need our help. I mean, we can educate their parents and also, big, students in high schoolers and in the middle schoolers. And also when you think about now in Korea, the personal training is such a hot issue here. Personal training or Pilates or yoga, there are a lot of people are very involved in, they're all interested in how to enhance their health. What kind of dietary supplementaries, what kind of protein powders, this medication is good or bad, is gonna be, issues anti-doping or not, lots of questions and lots of issues. We can all involve and help them out. So my suggestion would be to keeping attention and interest about the sports pharmacist and focusing on how to expand the scope of sports pharmacy specialists and attention to local community event. And volunteering in smaller and local event, club teams, high school varsity games, and personal training gyms and marathon races, and the Boston Marathon, for example. So when I visited Tokyo, they have JADA certified sports pharmacists. That was 100,000 pharmacists had the certification from the JADA sports pharmacist program. So I'll just ask them, what do they do? I mean, for Tokyo Olympic, they only need 50 pharmacists during that time. What other sports pharmacists do? Usually what they do is that they involved in local school or sports association and doing the education and supporting their medical staff. So for example, in the high school event, if they have a spring or fall sports event, they do the first day or last day doing education to the students or their parents. That's a very good, I think, good opportunity as a sports pharmacist. And also providing routine education program is another things that we can do. And also like this international, International Sports Pharmacy Symposium, or ISPS, the networking. This is another thing that we can actually continue our network and sharing our opinions and looking for other opportunities. This is another thing that it should be our action plan. I wanted to end my four conclusions with my presentation. Sports pharmacy is a new scope of pharmacy that you guys are initiator or advocates or also explorer. So you have to continue developing the new scope of our practice of pharmacy. And also it is our job to advocate and also expand the activity of sports pharmacy. And variety of opportunities should be developed. And also sports pharmacy may start from our community. This is the end of my presentation. Thank you for listening, and apologize my the English, but if you have any questions or comments, please feel free to ask me. Thank you. Let me end my sharing the screen. There you go.
Thank you so much, Sandy. That was really enjoyable. I feel like you hit on some key themes that we all have as we're practicing as sports pharmacists. And the same dilemmas that you listed, I hear that from pharmacists around the globe who are either looking at working in sporting events at any level, or if they're looking at how do I begin working with athletes directly. So those are excellent points. And I think we have a little bit of chat in the chat queue. And we just realized that we needed to open it up to everyone, so that has now been done, so you can all see each other's comments. And again, I would encourage you to use that as a place for networking. One of the purposes of this event is to network, meet other individuals who are in your own country. As I mentioned earlier, the sports pharmacy as a specialty is growing rapidly. We are recognized in the world of sports, but still among the pharmacy group, the global workforce of pharmacists, we're still a small group of people. And so it's really easy to reach out and connect with other individuals who are doing the same things as you. And so I want to open it up now to doing some question and answer with Sandy. And as I mentioned, a lot of the themes that she brings up here in her presentation are things that you're going to hear throughout the day. Just like an athlete has their mind set on getting to the Olympics, you are probably going to have that same type of mindset if you want to be a pharmacist that works at the Olympics. Most of the time, you can't just walk off the streets being a pharmacist in any pharmacy and expect to be accepted as a volunteer at the Olympics. You need to do your training, you need to have your education in order, and you need to have that mindset to work there. And so I appreciate a lot of the points that Sandy brought forward. And now I'm going to turn it over to Summer for a second to see if we have any questions.
Sure.
Hello again. Now I'm checking for the questions, but most of them, many participants are sending their thanks and congratulations to Sandy. And also, this was a very inspiring presentation. As usual, as at the first time, also Sandy was with us with her presentation. And I want to also thank to Sandy for your sharing your experiences.
And also, obviously, she is joining us from halfway around the globe from my 8 a.m. Mountain Time. And so I really appreciate you staying up late into the night. I know it's coming up on midnight your time. Thank you so much.
It's my pleasure. Anytime. I'm just also looking at the chatting, but not really have any questions to me.
I have kind of a general question for you then. So you were, because of the situation with the pandemic and Tokyo 2020, you were brought over to be, that source of knowledge and experience that they needed to help move things along and to be there as a source, as a reference for those other pharmacists. And I wanted to see, I don't know if you know Japanese as a second language, but just with working with athletes from all over, how do you manage the language barriers? Do you use translators with your patients at the Olympic Games or even with the other pharmacists?
Sure. So Most of the times we speak in English. Even Japanese pharmacists, they have a conversational English and proficiency. So it was not really that much difficult, but still it is, sometimes it's hard to understand when they are nervous. So we had a small pocket translator that, the applications that using the, phone, they can do things. But however, in every shift, there is at least one pharmacist speak in English pretty well. So she is the usually.
I'm going to turn off my video just to see if it changes her band.
That person is usually representative. Sure. A problem is that the English is not an issue, but when athlete speaks only French or only Russian, even only Arabic, this is it's very hard to communicate. Then that's the pocket, the translator working very well, pretty well. And also sometimes yeah.
Oh, do they have an on-site person that goes around with them to help them, or do you have some kind of a device or an app?
They do have interpreters inside the polyclinic, but I believe, but I don't think that working very well with an interpreter. Even Pyeongchang, because they don't have knowledge in medication in the pharmacy, it's very limited. I mean, they can help us to greeting or some other issues pick up, but not really counseling, explain the medications. So I think the pharmacist, one of the pharmacists or some pharmacist has to speak in at least English pretty well. Then there is not actually the problems, anything. But we had a little bit small survey with a Japanese pharmacist. What was the difficulties, why they are doing their service? I think the language, the conversation is the third difficult ones that they wanted to overcome, but it's not really. But the problem is the language barrier is not really overcome in short time period. So I think also it is more likely Asian countries issues. So that's something that we have to keep working on.
Yeah, this is one of the pieces of being in sports pharmacy and working at these major events. You discover these, these small barriers where you might have some experience in your pharmacy practice or at the hospital that you work at or the clinic that you work at, where you know ways to overcome this. And just talking to you right now, I think of the online medical translators that we use in our hospital, because we're required to offer translation services at a medical language degree level for our patients to ensure that they understand those correctly. And as all pharmacists know, a name of one medication in one country might not be the same in another country. And so while there are international normalized non-proprietary names for medications, there are different brands and things that could be easily confused or lost in translation. So I think that's an interesting point of discussion.
Yeah, that's very good points actually. Because even in ibuprofen, the maximum dose is different from United States and Japan. Japan has much lower maximum dose. So the pharmacists are surprised that, oh, how can I dispense that? Which is okay dose in the United States, especially for athletes. But this is the issue that need some kind of support by international groups. But as long as there is another thing that we have to overcome is the security issue. The Olympic is very, very important about information privacy, HIPAA issues, especially for athletes. So I'm not sure that they can open up the online support with the other countries, but at least if that country has a good number of sports pharmacists in that country, even though that person cannot be in the polyclinic, but still they can get support from looking at the something information specialist. They can help them. When you guys have the Olympics, it's LA, right? Next Olympics, LA. I mean,
that's right.
If you are busy to be in that, the polyclinic, you can help the pharmacist because you have a lot of, experience with the sports pharmacist and sports pharmacy area. So this is going to be really good, the idea to help them out.
Yeah, just one more piece on this topic, then I'm going to turn it over to Summer. Claire just mentioned in the queue that there are some inaccuracies if we do these online translations or using those apps. And the app that we use in the hospital is actually something that the hospital pays for. And so they're trained in medical terminology, and they are familiar with pharmacy names, for instance, or correctly translating a diagnosis in order to appropriately translate that information. So they're actually medically trained translators.
Sure.
And then
Yes.
Summer, I'll turn it over to you in case there's other questions.
Thank you so much, because the questions are increased as I see here. Let me read by order. From Tarek Kaleji, how do you see the future of sports pharmacy and its impact on pharmacy in general?
How do I see the future of the sports pharmacy?
The future of the sports pharmacy, in your point of view.
I think it will be much, much bigger because people live longer and they are more like interested in general health. And I mean, many people doing some kind of sports involved whole their life. Even in Korea, I mean, 70, 80, they're all doing the yoga or Pilates and lots of PT, personal training. It doesn't matter the ages. And also because of that, because of population, lots of small competitions, local games are getting more and more in Korea. And then sometimes they do stop by pharmacy because depends on the competition. They have a anti-doping regulation applied in the certain games. Then they can stop by, pharmacists to ask about, what they can do during the training or right before the game, during the game. I mean, as we all know, the anti-doping prohibited medications all depends on when they use, during the game, out of the game and stuff. They can do have a consult on it, or also dietary supplement is another area that nobody can answer. Even simple multivitamins or even simple protein powders, people tended to buy from the internet shopping, right? Online shopping mall, which is not really certified or standardized at all. I mean, so that's something that pharmacists can give them information or recommend good product, or I mean, this is a lot of opportunities for the pharmacists can do. So, and also in Korea, we have a traditional oriental medications we use, the Chinese medicines like that, tend to have steroids in it. So how are we going to counsel with the people who are doing sports for their recreation and prior to the competition? Then still we have to do the counsel them. And also, I found another interesting issue is that when athlete has injury, I don't know why they're afraid to use the medications because of the anti-doping violation. At that time, pharmacists should step up and tell them to actively treat with whatever medication they have, which is okay. Depends on the the period of from the game time, and also how the treatment period or treatment medication, treatment dose. This is another encouragement to active treatment. Also, once they finish the treatment, we also tell them not to use the medication anymore by long-term adverse reactions and all the stuff. Still, we have to counsel and consulting them, team and trainer and doctors together. Yes,
Sandy, I agree. You take attention, really an important point. As pharmacists, it is not limited just for the professional sports or athletes. We have responsibilities for all the community health.
Right.
Yes, you take attention to this point. And we have some questions, and please, maybe we can a little bit faster about answering. From Hafiz Yuja, thanks for your nice presentation. I would like to ask athletes use herbal remedies at the Olympics, as you mentioned now. Have you had any experience with this, especially your Chinese medicines, especially I think 2008 at Beijing Olympics? There were many Chinese remedies or Chinese medicals used.
Yeah, during the Olympic Games, those athletes has a certain level of knowledge about not to use unnecessary medications. And also they have their NOC doctors come together with their teams. So not really have any issues with the Chinese medicines, but Chinese medicine issues is more likely in now near me, community-wise. People ask me, PT trainers, and also the high school athletes, their trainers, their coaches ask me if it's okay to, because Chinese men supposed to enhance their general health, more like not really, treating their certain, the disease. So they wanted to have those Chinese medicine for, 6 months time period before the games. They always ask me that if that Chinese medicine that they are taking during the 6 months period will be effect on their level during the game time. These are kind of issues that I got the issue, but there's no issues during the Olympics and stuff. In the athletes, they are very well managed by, those medications.
I just had a follow-up question to that. Is there a list of herbal products or, any kind of herbal, what am I trying to say? Any kind of herbals, I guess, in general, that are prohibited? I mean, there are just a few naturally derived chemical constituents that are listed on WADA's list, but I've never seen a full, full herbal medicine.
You're right. There is no like, prohibited list of dietary supplementary or herbal medicines. As you know, the WADA said that they're not really involved in the how do they use the herbal medicines, but if something happened, then it's the responsibility of the athletes. Yeah. So this is it. So for me, I just have a list of our brand product available in community over-the-counter medications, and there is certain like mahuang. I'm not sure that someone knows that thing. Mahuang, like ephedrine, substitution constituent, right? Yeah. The mahuang is used as a coughing medicine in Korea, as over-the-counter, as a combination medication with other substances together. People tend to know what's inside there because there's already 3 or 4 different kinds of herbal component together, selling as a over-the-counter cold medicine. So sometimes I do the picture of those popular ones and show them, if you look for anything that name, then it's probably better idea not to take that. This is the only way that I have.
And just before we go on to the next question, I just wanted to mention also that you had mentioned that athletes will avoid taking medications. We definitely have a big sector of the athlete population who will be afraid to take medications that the general population might otherwise use to treat an acute condition and take care of their problem because of their fear of whether or not that is prohibited. And I find one of the most valuable pieces of advice or one of the most valuable spots where the pharmacist can be is letting them know, I am sure this is not prohibited. I am sure. Right. Okay. And so when you have that confidence yourself and 100% that it is not prohibited, then you can then tell them it is okay to take. And then, with that trusting relationship, they can be treated appropriately. And the duration, again, is so important. You mentioned that as well.
Right. And also, if it is a prohibited medicine, it's fine to file the TUE and use the medication, treat your injury first right now, so that you can have a long run of your career as a sports athlete. That's something that only pharmacy can tell them. Not other profession can tell, like they confidently. There's not really, talking about the medication wise. I mean, doctor can do diagnose or rehab, physio, all the stuff. But medications, we definitely can tell them about it.
Okay, may I ask the other question? Okay, from Aiden and thank you, Sandy, for this great presentation. Of course, the Olympic and Paralympic Games itself have a set time period, but if successful in an application to be a volunteer as a pharmacist, how long would the preparation period be prior to and after the games? An extended commitment period may be before and after the games as a volunteer pharmacist.
After, you mean the after games?
I think shortly asking for the volunteer period, being a volunteer as a pharmacist before the preparation period and while the organization period. Asking about this.
How much experience they need to have to be the volunteer pharmacist?
And also it needs a time. For example, you have to be a volunteer pharmacist. For example, 6 months ago, make an application for being a volunteer pharmacist. This about this way, they
I think
he's asking. Aydan M is asking about this period.
sure. I think it depends on the games. I think Japan started to recruit. I'm not sure this Japanese pharmacists in that symposium. If I am wrong, just to tell them, tell me. I think Japan, they started the preparation very early. I think 3 years before the opening of the Olympic. So I believe they open up the recruiting the pharmacists, I think 3 years before the game, and then they have several sessions of training. So one of the requirements to be the volunteer pharmacist, they have to complete all individual training sessions. Then they are allowed to be eligible to be the volunteer pharmacist. And in Pyeongchang, we don't have that much time to do it. So, I mean, this is a time that I was very nerve-breaking because my pharmacists are not really trained about those kind of sports pharmacists. So that's why I have to make the daily report. That was the one thing that I wanted to make sure they review every day what we have dispensed. So this is my kind of like way that I make reduce the inadvertent errors by the mistakes by the pharmacist. So we only have, I think before me, there is another head of pharmacist to preparing the Pyeongchang Olympic Games. That was 1 year before. I think 1 year. They started recruiting pharmacists and then train them a lot. But it was kind of vague during the time. And once I get into the head of pharmacist, I just have them and train pharmacists. I just very quickly and very, one by one training at the time.
Okay, thanks again. And I think last two questions from Carol from Poland. There is in Japan, the Japan example, is there any prerequisites as government regulations on education and specialization in sports pharmacy? I think there is a certification program for the sports pharmacy.
Oh.
This is the beginning
So
of
Japan has the sports pharmacist certificate program by JADA. Yeah, there's 100,000 pharmacists already certified since 2008 or 2009, I believe. But it wasn't a requirement to be the volunteer pharmacist Tokyo. They're not really looking for, that wasn't the criteria to be the pharmacist. But coincidentally, all of them were certified because their population is already too big. So when I went to Japan, the pharmacists in Japan in Tokyo Olympic, they have already good knowledge about anti-doping medication, what's the prohibited or not. So it was much relieved and really, I mean, this is very I have the confidence that they can run the safer pharmacy, during the time. So with an answer to that question, it's not really required any other specific education. I mean, me and Tokyo, Kumiko also wanted to have a pharmacist to have a good practice skill, which is very subjective. I mean, as long as they have a pharmacy license, they all are eligible to be the pharmacy volunteering.
Okay, thank you. And the last question from İpek Boşvermez, Turkey. Many thanks all. What was the most interesting case or the most complex case you or your colleague encountered?
I have things to boast. One of my pharmacists, I think that day she was checking one medication, one ingredient by one ingredient through the globaldraw.org website. That medication was common cold medications, over-the-counter medications, which is whatever, right? The over-the-counter medication. What else are there? I mean, pseudoephedrine wasn't there. So what else do we need to worry? And there is a one beta agonist in there, which we don't use as inhaler ingredient. So, and also nobody knew because it was that ingredient only used in Asian countries. So it's not really familiar with the UK. I mean, Mark, not really familiar with the ingredient. And also United States, I never seen that ingredient before. I practiced in United States for 10 years. I never seen the ingredient before. So it was just, she found it because of her peculiar characteristics to check one by one, make sure that there's no error. And that year, the ingredient was included in the globaldraw.com. I mean, not global draw, it was included in the pharmacy guide formulary as a thing. So that was a very proud moment as a pharmacist. And also difficult moment is Winter Olympic was very cold. Summer Olympic was very hot. And
Sure.
also, I think the thing is that people think that we were enjoying opening ceremony. They think that we went to closing ceremony. We went to certain games, if I want to, but not really. We just restricted. Our pass is only allowed to be in the polyclinic pharmacy and go out and go in, that's all. So all the pharmacists' daily life was after shift, they go home and they're not allowed to contact with any opening public because of COVID. They come back next morning and whole day in the pharmacy and go back. So this is kind of like, we watch the TV, the opening ceremony, although I heard that, there's a game sound, we'll be just watching the TV. So this is a, kind of, I don't know, sad. I'm old, but I'm okay. But there's a young pharmacist, so wanting to go, I see their face, but this is not allowed for us to go. So this is kind of challenging and tough moments.
I find that as well when participating at events, you are behind the scenes. You're a volunteer, and so you can't be a spectator at the same time. You can balance that and find time for it, but it is one of those trade-offs that you have to make when you volunteer at events. So if there are any more questions somewhere, we will have a break at 12 o'clock Mountain Time. So just a couple hours from now, where we will continue to address questions. I know I took up a lot of that time asking more general questions about sports pharmacy, because in the beginning of this symposium, we're kind of painting a picture for you from big and how we can break it down to be small. So in my way of thinking and my approach to sports pharmacy, or putting together resources for athletes, or whatever that might be, my thought process is, okay, what is that goal? Now, how do I get there step by step? And so our next presenter is going to be Claire May, who has a lot of key points for you on how to take those steps. Sandy touched on it a little bit with her experience about how having great communication skills and being a great pharmacist are really some foundations that you need before you really can sell yourself to be a volunteer at major events. So Sandy, thank you so much for your time, and I'm sure we'll be in touch real soon.
Sure, thank you so much for listening. Thank you.
Thank you, Sandy. Take care. Thank you.
All right, and now we're going to jump right into the next presentation and keep on track here. Claire May is currently in an academic role working with pharmacy students, or student pharmacists, I should say, would be more appropriate. And she, again, has lots of experience at working at major sporting events, but she is also a thought leader when it comes to sports pharmacy. And I'm not going to do too much introduction because she's going to talk you through her story and her experience. So take it away, Claire. Thanks for joining us.
Thank you so much, Ashley. And I'd really like to thank Sandy for her great start to the symposium. I was lucky enough earlier to go into the